60% of adults in the United States experience lower back pain at one point of their life, and 10 to 12% of the population are seeking treatment for it at any given time, making it one of the most common types of pain. For many, episodes of low back pain are short-lived, resolving with or without treatment in about 6 weeks. But up to a third of those who visit their doctors with back pain may still have pain after 1 year. Anyone can have back pain, but there are factors that increase your risk, such as age. The first episode of lower back pain typically occurs between the ages of 30 and 40. It becomes more common with advancing age. Those who are obese or are not physically fit are also more likely to experience back pain. Having certain diseases, such as various forms of arthritis, can also increase the likelihood of back pain. And having a job that requires heavy lifting, pushing or pulling, and twisting or vibrating the spine can lead to injury and back pain. An inactive desk job may also contribute, especially if you have poor posture or sit in an uncomfortable chair. Smoking increases your risk, possibly by blocking your body's ability to deliver nutrients to the discs of the lower back. Repeated coughing due to heavy smoking may also cause back pain. Smoking can also slow healing, prolonging pain for those with back injuries, back surgery, or broken bones. One of the most common causes of lower back pain is overuse of back muscles. Lifting something too heavy or overstretching can cause a sprain, strain, or spasm in one of the muscles or ligaments in the back. Pain can also result from chronic overuse of specific muscles, such as can occur with scoliosis where the spine is curved and movements favor one side over the other, or if there is a problem with the lower limbs. Weak abdominal muscles and excess abdominal fat can also put a strain on the lower back. Another common cause of lower back pain is a disc that has degenerated or weakened. The tough covering of a disc in the spine can tear, causing pain, and the soft jelly-like interior may bulge out or herniate through the covering, causing more pain when it puts pressure on the spinal nerve root next to it. Sometimes the nerve roots may even be damaged. Where the pain occurs depends on which disc is herniated and which spinal nerve root is affected. The pain is felt along the pathway of the nerve compressed by the herniated disc. For example, a herniated disc commonly causes a type of pain called sciatica. The sciatic nerve runs from the lower spine down the buttock, behind the hip joint and back of the knee, with branches continuing to the foot on each side of the body. Sciatica is pain that occurs when the roots of this nerve are pinched, inflamed, or damaged. It radiates along the length of the nerve to the foot. Sciatica may cause a pins and needles sensation, a nagging ache, or a sharp shooting pain. Numbness may be felt in the leg or foot. Spinal stenosis, a narrowing of the bony canal that contains the spinal cord, predisposes some people to pain related to disc disease. Some people are born with spinal stenosis, but spinal degeneration from disc wear and tear can also lead to narrowing of the spinal canal. A person with spinal degeneration may experience stiffness in the back upon awakening or may feel pain after walking or standing for a long time. Specific diseases or conditions that commonly lead to back pain include osteoarthritis, ankylosing spondylitis, rheumatoid arthritis, osteomyelitis, spondylitis, sacroiliitis, and tumors. Spondylitis refers to chronic back pain and stiffness caused by a severe infection to or inflammation of the spinal joints. Other painful inflammations in the lower back include osteomyelitis, infection in the bones of the spine, and sacroiliitis, inflammation in the sacroiliac joints. Bone spurs, a buildup of calcium on the edges of the vertebrae, or collapsed vertebrae, may also result in back pain. Occasionally, low back pain may indicate a more serious medical problem. Pain accompanied by fever or loss of bowel or bladder control, pain when coughing, and progressive weakness in the legs, may be a sign of impending paralysis and should prompt an immediate visit to your doctor. People with diabetes may have severe back pain or pain radiating down their legs related to disease of their nerves called neuropathy. Symptoms of lower back pain can include muscle spasms, cramping, and stiffness. Pain can be made worse by weight-bearing or specific movements, or by forcefully contracting the core muscles of your trunk, such as with a cough, sneeze, or a difficult bowel movement, or if you hold your breath during an activity. Pain may develop quickly or over a longer period of time. It generally occurs in episodes and is often relieved by rest. The most severe pain usually lasts 48 to 72 hours and may be followed by days or weeks of less severe pain. The back is easily re-injured during this period. Pain related to pressure on nerve roots often extends below the knee, starting in the buttock and traveling down the back of the leg as far as the ankle or foot. Nerve-related problems are also indicated by tingling, numbness, or weakness in one leg or in the foot, lower leg, or both legs. Weakness or numbness in both legs, along with loss of bladder and/or bowel control, are symptoms of cauda equina syndrome, which requires immediate medical attention. Depending on the cause, symptoms may be better or worse in various positions, such as bending forward or backward. Symptoms that increase on bending forward are usually relieved by walking, lying down, or other movements that straighten the spine. And symptoms that worsen on standing or walking are usually relieved by sitting down or lying down on your back with your knees bent and by gentle exercises to bend your spine forward. Symptoms of arthritis of the spine generally include pain and stiffness that are worse in the back and hip region. Arthritis pain starts gradually, gets worse over time, and lasts longer than 3 to 6 months. It is generally worse in the morning or after prolonged periods of inactivity. Arthritis pain gets better when you move around. Symptoms caused by arthritis and symptoms due to back injury are often similar and commonly occur together. Your family doctor will probably be the first person involved in the diagnosis and treatment of your back pain. Depending on the severity of your pain, diagnostic tests to be done, and the treatment you require, other physicians and healthcare providers may become involved. Your doctor may refer you to a pain management specialist who can coordinate your care between a variety of specialists as needed. A neurologist might assess you to establish the exact diagnosis by EMG studies, and a radiologist will be responsible for many of your diagnostic tests. If surgery is an option, a spine surgeon will be consulted. A rheumatologist may also become involved in your care if osteoarthritis or rheumatoid arthritis is involved in your pain. A pain specialist may also assist you in your pain relief by performing specific procedures or nerve blocks. Management of your back pain will almost certainly involve physical therapy that will be supervised by a physical medicine specialist and/or a physical therapist. To assess your lower back pain, your doctor will take a thorough medical history and do a physical exam. The history will include episodes of trauma that may be causing the pain, such as twisting, falling, or an impact injury such as a car crash. The history can also help to identify another condition that may be associated with the pain. The doctor will also want to know the characteristics of the pain, where it hurts, how you describe the pain, when the pain began, the current severity, what relieves the pain, what makes the pain worse, and any limitations in movement, as well as previous episodes and health conditions related to the pain. Also, how the pain affects sleep and is it related to stress, etc. Make sure that you tell your doctor about any other medical problems you might have, as well as any current medications you're taking on a regular basis. The physical exam will include an assessment of your ability to bend and twist and to raise your legs straight while lying down face up. Your doctor will also look for evidence of any bruising or deformity. Your doctor will examine your back and carry out specific neurologic tests to determine the cause of pain and appropriate treatment. Tests may include assessment of whether or not you have normal strength, whether your sense of touch or muscle strength has changed, and whether your reflexes are normal. There are a large number of additional diagnostic tests that your doctor may use to help determine the cause of your pain. The first test is often a conventional X-ray, which can reveal broken bones or a compressed vertebra. This fast, non-invasive, and painless procedure is usually performed in your doctor's office or at a clinic. Your doctor may also ask you to undergo other tests aimed at providing more information about the anatomy of your back. Computerized tomography, also called a CT scan, is carried out with a combination of X-rays and a computerized scanner. This procedure is also painless and is often used when disc rupture, spinal stenosis, or damage to vertebrae is suspected as a cause of low back pain. Computerized tomography is generally conducted at an imaging center or hospital. Magnetic resonance imaging, also called MRI, is another way for your doctor to see the anatomy of your back. This procedure can provide a very precise picture of the bones, muscles, discs, and ligaments. Like CT scanning, MRIs are usually carried out at an imaging center or hospital. CT scans show bony abnormalities better, while MRI shows the soft tissues and nerves better. Your doctor might also recommend that you undergo discography. A special contrast dye is injected into the intervertebral disc thought to be causing low back pain. The dye outlines the damaged areas on X-rays taken following the injection. This procedure is often suggested for patients when the intervertebral disc is suspected to be the source of pain or when the surgeon is sure about the level he needs to operate on. Another diagnostic procedure that involves dye injection is called a myelogram. The contrast dye is injected into the spinal fluid to outline the spinal cord and nerves. It helps to assess nerve compression caused by spinal cord and nerve compression caused by herniated discs or fractures to be seen on an X-ray. Bone scans are used to diagnose and monitor infection, fracture, malignancy, or disorders in the bone. A small amount of radioactive material is injected into the bloodstream and collects in the bones, particularly in areas with some abnormality. X-ray images reveal the radioactivity and are sent to a computer to identify specific areas of irregular bone metabolism or abnormal blood flow, as well as to measure levels of joint disease. Your doctor might also recommend any of several electrodiagnostic procedures. These include electromyography or EMG, nerve conduction studies, and evoked potential studies. Electromyography assesses the electrical activity in a nerve and can detect whether muscle weakness results from injury or a problem with the nerves that control the muscles. Very fine needles are inserted in muscles to measure electrical activity transmitted from the brain or spinal cord to a particular area of the body. In nerve conduction studies, the doctor uses two sets of electrodes that are placed on the skin over the muscles. The first set gives the patient a mild shock to stimulate the nerve that runs to a particular muscle. The second set is used to make a recording of the nerve's electrical signals. Your doctor will measure the speed and strength of the signals to determine whether there is nerve damage. Evoked potential tests also involve two sets of electrodes, one set to stimulate a sensory nerve and the other set on the scalp to record the speed of nerve signal transmissions to the brain. Your doctor may also use injection of a local anesthetic to selectively numb certain nerves or joints and assess any change in symptoms. This can also help to localize the source of your back pain.